Dr. Repchuk is in Romania, and it's a bit later for him right now, obviously, but I've been really excited to meet him because he is on the forefront of ozone research here in the world, and that's really exciting for somebody like me who is really working on ozone from the veterinary point of view as far as getting training and equipment and everything to people. So I'm really appreciative of you and what you're doing. I haven't known you long, but I really look forward to getting to know you more, and thank you for being here. Go for it.
Well, it's a pleasure for me, and it's an honor for me to be here. I will just present you some easy research that we've done. And this is regarding this is about wounds, actually, about chronic wounds in more species. I said here topical ozone therapy. Okay, I will present the topical thing, but I combined it with injectable as well. So probably this won't match exactly. The title won't match exactly, but mainly it's about topical protocols. Okay. The effects researched by us were actually ozone promoting chronic wound healing in more species, the antimicrobial effect of ozone, the topical antimicrobial effect of ozone, and then later on the anti-inflammatory effect, and maybe ozone activating platelets in PRP. Here you have the first paper we've done actually on horses. It's actually evaluation of the therapeutic effect of ozone in the treatment of chronic wounds in horses. We had lots of cases with wounds on the distal limb area, and they were treated for many months in the field by several veterinarians, and they didn't heal at all, and they got complicated, and the owners actually came to our clinic in the university, and we managed to do something with them. Okay, to heal them actually. What was the protocol we've used? Probably it was a bit exaggerated due to the classical protocols. We've used 50 micrograms per milliliter ozone concentration, 30 minutes exposure each 48 hours until complete healing. It was bagging technique, wound bagging technique, or a limb bagging technique. Okay, it worked really nice. You will see later on. Some tips: always try to protect the bags. The bags will break in horses. They are not so obedient as people are, to stay with their hands up and the bags on their hands and stuff. So an easy way to protect them, it's by making a bandage, a protection with cotton and with a bit of vet wrap. It's fine, it's okay. Or for example, we've used something more special. This is in the lower part of the screen. You will see the image on the right. That's a membrane for artificial vaginas for stallions. It's the disposable membrane from inside. We use that because it has two openings, and we were able to leave the horse putting weight on his hoof without any problem. Use two tourniquets to fix it, and it's fine. It won't de-inflate, or the ozone won't come out. Everything will be fine. Okay. What we've seen there in the last 2/3 of the treatment period, everything expanded, like boom, everything was epithelializing. The wounds were really nicely epithelializing. They closed quite quick. imagine that we had horses that were treated for 14 months in the field. That was crazy, and we managed to close them to close their wounds or to heal their wounds in days. Okay, it is really interesting. Okay, I will present you some of the cases because this is the most interesting part. Probably the research and data, it's more boring. I will present you some pictures. This was one mare with a wound, a chronic wound, an old wound at the level of the fetlock, one front limb, and you can easily see the evolution in 48 days. It healed in 54 days. There was a lot of granulation tissue at first, but we never leveled the granulation tissue, so we never cut it off. It was healing really nicely. The granulation tissue actually disappeared somehow. We used also compressive bandages, compressive dressings, and this thing helped somehow. Yes, please, Jonathan, you appear there. You have a question.
Yeah, one quick question. So
yes, please.
You might get to this, but have you done the limb bagging at various concentrations, and have you seen any difference? Because
no,
okay,
I didn't do the bagging for these cases at different concentrations. I did it with 50 micrograms per milliliter. That's why I said it's a bit different than the standard protocol. It worked really well. It wasn't too harmful for the tissues, as you can see.
Okay, great. So all of your treatments you've done pretty much at 50 micrograms all the way through the treatment?
Yes, because this was the protocol we fixed for this study. So that was it.
Great. Thank you.
You're welcome. This was one of the cases. Then we had many other cases with the same evolution, good evolution, great evolution. For example, in this case, there was not too much necrotic tissue on the surface of the wound, but there was still a bit of fibrin. And at the beginning, when we started treating it, it was infected for sure. This one was treated for about 5 months in the field. There was some superficial flexor tendon injuries. The deep flexor tendon was touched as well. The horse, the mare, because it was a mare, didn't even put the limb down. She was jumping like a dog in 3 limbs. And after the treatment and after the wound healed, she was okay. She was able to walk normally. She still had some limping signs, but she was able to walk, and she was walking with her owner on her back, and that's great. Another case, this was a bit more interesting, was a bit more complicated. A mare, 21 years old, something like this. She got an injury during transportation. She was treated for, this one was treated for 14 months in the field, and she developed at that level of the pastern, she developed a huge exuberant granulation tissue mass. We actually removed that mass, and it looked immediately after, it looked like in picture A, and then 67 days of treatment, and it worked pretty well. She got back to work, and the owner was very happy. Another case, 3 years old, stallion, Frisian stallion, again traumatic injuries during transport. Lots of necrotic tissue all over the wounds. They healed in 40, respectively 56 days, because you have 2 wounds there. As you can see in the pictures, they evolved differently. The depth of the wounds was different, and that's why this difference in healing time. Another stallion, an Arabian stallion, with a huge exuberant granulation tissue mass at the level of the metatarsus. This stallion was treated for 1 year, and they didn't at one certain moment, they said, okay, we will slaughter this one. We cannot do anything because we just level the wound and level the wound and level the wound, and it doesn't heal ever. Yes, it didn't heal because the mass had already periosteal origin. The initial wound actually touched the periosteum, and it was quite massive because we had to remove the mass, and it was a quite difficult surgery because we had to resect a bit of the bone of the metatarsus. It was interesting. Okay, anyway, this is why it healed a bit in a bit a longer time, in 91 days. Also, you can see in the first picture that all the surrounding tissues are quite interesting, quite messy, quite fibrotic, quite edematous. They are not really nice looking, and this was as well a factor to prevent quicker healing.
So a couple of things, if I can interject here. So first of all, I don't know if you're going to do this later on in your presentation, but can you walk us through what your protocol is? Just kind of tell people how you do it.
This was just bagging the wound. That was it. Nothing.
Tell us how to bag. Tell us how you bag, what you do.
Actually, you actually fix the bag around the wound. I've told you that I've used those artificial vagina membrane for stallions. I used it. I've put it around the limb. I've inflated it with ozone until it was hard to palpate, okay, and left it there for 30 minutes.
Okay, so it's 50 micrograms.
Hours. Yeah, 50 micrograms, 30 minutes exposure, each 48 hours, okay, 2 days, at an interval of 2 days, each second day, let's say.
Do you wet the limb first? Do you moisten it at all, or do you do anything else?
Yes, of course, we did a usual flushing with saline for just removing the fibrin or debris that it was there, and that's it.
Do you use ozonated saline or no?
No, I didn't use ozonated saline because I didn't have a bubbler.
Okay.
So I used just saline, and that was it.
Okay.
But it worked nice.
Have you ever used oils? One of the Cedric asked, have you used have you ever used ozonated fluids with it, or oil to help healing? Okay.
No, I've used it in the clinic, but not in these studies.
Okay. Okay. Great. Thank you.
You're welcome. Good. Another thing that we've actually wanted to check was the antimicrobial or antibacterial effect of ozone bagging in horses with chronic wounds. Okay, again, the chronic wounds of horses, limb wounds. We did the same protocol as we've discussed now with Jonathan. We did the local flushing. We cleaned the wounds before doing the treatment. We did the superficial debridement with maybe some sterile gauze pads, and we did the microbiological sampling before and after the treatment. Okay, so we did this for 2 treatment sessions. So this way we have a comparison way or a thing to compare with. Actually, we had great results for, let's say, such a low dose for antibacterial effect, because 50 micrograms per milliliter, it's a mid-range dose for antimicrobial effect. We had 63.06% bactericidal efficacy after the first day, after the first treatment, and 93.81 after the second treatment. And I think that is perfect. That is enormous at such a low dose for antimicrobial efficacy. Good. Other treatments. I said that I've introduced here, even if it is not really topical, the ozone subcute injections with ozone for the ozone subcute injections with in wounds, in chronic wounds, in pets, in dogs and cats. Okay, so here is a paper we've wrote. It's 2 case reports, 2 male dogs. we've used this protocol actually, subcutaneous 12-15 micrograms per milliliter. It varied with the advancement of the wound stage. 1 2 milliliter gas volume inoculated per point of injection, and the injection points had a distance between them of 2 to 3 centimeters. We've evaluated it photographically, and of course we did some protection bandages for this patients. Good. The first case was a Dutch Hound, a male, 10 years old male, so it was really old for a Dutch Hound. He had a 20 square centimeters wound at the level of the hock. It was really, really bad because my colleagues tried to treat it for many days. He did not respond to the classical treatment. There was a lot of necrotic tissue around. There was quite a severe infection with a bacteria which was quite resistant to antibiotics. And they said, okay, we don't know what to do anymore. Do your job, do your thing here. Try to fix it. And they came with the dog to me, and we did infiltrations, perilegional infiltrations, and bagging as well because of the bacteria present there. And you can see that in 16 days, a deep, nasty wound was completely closed, and the dog was using his limb normally, and everything was fine. And the other case, it's a German Shepherd. It was a German Shepherd, 7 years old, 400 square centimeters wound on the neck. It was a wet gangrene, which was treated by my colleagues. They managed to get it to this stage in picture A, and they said, okay, we want to close this quicker. We want to advance a bit with the contraction phase. And then they came to me and they said, okay, do your thing. And it went really, really well. We've injected it. We just injected perilegionally, and you can see that in 46 days it was completely closed.
Wow. So a few questions for you, if that's okay. I'm sorry.
No problem.
When you do the insufflation, do you insufflate the bag and leave it there, or do you continuously flow ozone into the bag?
Insufflate the bag and leave it there. The bag's volume, it's huge. Actually, yeah. It has a diameter of about 25 centimeters, these bags that I've used. So I think it's more than enough for that slim limb of a horse. Okay.
Okay. And this, the previous, I think, one, was that injection of ozonated saline? Did you inject ozonated saline in one of those cases, or? Okay.
No, we didn't inject ozonated saline. We've just injected the gas as it is. Subcute.
Next question.
Yes,
Sylvia asked, did any horses get tested for epithiosis? Any experience using O3 for that?
No.
Okay, so not sure. And we might be able to answer some of those questions later on in the Q&A as well.
Yeah.
Were antibiotics used in these dog cases at all?
Before treatment, yes.
Okay, before, but not after they came to you.
After we used antibiotics because they weren't efficient, as you could see. At least in the Dutch Hounds case, they weren't efficient.
Okay, all right. And last question, do you have any idea what the bags were made of that you were using for limb bagging?
I think I can remember that it was polyethylene or something like this.
Polyethylene, yeah.
Yeah.
And polyethylene's pretty good actually with ozone, so that's good.
We saw that there was no damage. First, we've tested them because we know that there are some certain materials which will react with ozone, and we've tested it, and it was perfectly intact. No strange smell, nothing, and we've used it, so it worked. Okay, another case. This was not put into this study or case reports. It was an 8-year-old husky female with a wet gangrene due to drugs reaction. Yes, it was a drug reaction, but not local administered drug reaction. It was a reaction to some systemical IV antibiotics. It healed in 40 days, okay, but I didn't want to underline that thing. I wanted to underline that you have there in the last picture a lot of new grown hair just on the line where we've injected the ozone, and there's no hair on the other side of the body. So it was interesting to me, for me to see that actually I think that ozone helped with the regrow of hair. In this case, it was quite interesting for us to see that. Okay, another case, another nice case, FIV positive cat, which we did scapulectomy on. We've amputated the front limb. It was completely compromised, and the wound got dehisced because of the immunosuppressed animal. And it was really nasty. You can see here in the left side of the image, the lower image, the smaller image, the appearance of the wound after 14 days of classical treatment with antibiotics and everything. It was expanding, actually, not closing, and we all got a bit scared. And my colleague said, "Okay, let's try your thing as well. Let's do it." And we began infiltrating subcute with ozone, just putting there a normal dressing, a normal protective dressing, and in 45 days, everything got closed and everything was nice and everything was healed, and the cat was okay, was doing fine. Because of many skepticals that said, okay, this was one case, you cannot generalize everything on one case. Yes, of course, I agree with them, but we have here some papers written by others. These were experimental papers or studies on acute wounds, 4 square centimeter wounds. One was just with bandages. They induced the wounds and they just bandaged. And the other one, the Mitsui paper, was ampicillin plus bandage. So these were acute wounds. Let's remember these were acute wounds. We had a 40.15 square centimeter wound in a chronic FIV cat. So in after the first 7 days, the first study with just bandage, they had 18.3% reduction of the wound surface area. We had 81% reduction of the surface wound area. Done in the second study, in the Mitsui study, in day 40. So in day 40, they had 92.5% reduction of wound surface, and we had 97.2% reduction. So we are talking about acute versus chronic wounds. So those were acute wounds, which will for sure will heal quicker, and we were fighting with a chronic wound in a immunodepressed cat. So it's quite relevant for me, hopefully for others as well. Good. So in conclusion, we can say that it has great antibacterial surface antibacterial effects. It really promotes the contraction phase. In this cat, at least, it really promoted the contraction phase. I could observe that in horses as well in the first treatment period. The peripheral blood flow, it improves really nicely when you pinch with the needle. After a couple of treatments, you see that there's a lot of fresh blood coming out, thing that does not happen at the first or before the first treatment. It works really well in immunosuppressed patients, you can see. Good prevention of exuberant tissue growth, of exuberant granulation tissue growth. In those horses which I've presented, I've never leveled the wounds. The tissue, the exuberant granulation tissue, which was there at the beginning, just disappeared, just retracted. Okay, so that was really impressive for me because I've always had to level those exuberant granulation tissues with classic therapies. Okay, but of course we need a lot more clinical trial studies, and these studies are not easy to perform because wounds are not similar. Their depths are not similar. So if you want to do, let's say, a standardized study, you have to induce those wounds, and I really hate doing that. hopefully we will do more studies on wounds and sporadic wounds. Okay, Jonathan,
Great.
you have
So,
some?
yeah, real quick, just on the cat case. So, were you doing bagging again, or was that?
No, it was just under subcutaneous infiltrations, perilesional
of gas.
Yes, of gas. That was it.
Okay, and what concentration?
12 micrograms per milliliter.
Okay, and what was the volume that you were putting in?
The volume, actually, it depended. It depended with the surface of the wound, because the volume reduced as the wound reduced. Because I've said before that we put 1-2 milliliters per point, okay, per injection. And the injections have 2 or up to 3 centimeters distance between them perilegionally, okay, perilegionally around the wound. So this will influence the total volume for sure. Okay?
Yeah.
Good.
Do you find that the cats that they tolerate that okay? Do they tolerate
this cat tolerated it well? I had some cats which didn't tolerate the infiltration, the injection, actually the pinch, the needle pinch. They didn't tolerate it, but they didn't have anything. They didn't react weird at the inoculation of the gas. They didn't react weird at all, even if we know that it's a bit itchy and a bit unpleasant to have it under your skin in the first few seconds, but they didn't react at all. They were fine. They were okay.
Well, I'll let you finish your presentation now.
Good. Other important facts that we've seen in our research was the anti-inflammatory effect. Okay, and somehow the regenerative effect. But this is with a question mark, because it needs a lot more research. The thing with the regenerative aspect. Okay, we did a study in rats. We've induced septic peritonitis in these rats and treated them with ozone at 30 micrograms per milliliter and 50 micrograms per milliliter concentrations. These are the images, the histopathological images of the untreated group. Okay, there's a lot. You have in picture A, you have peritoneum. In B, you have epiplon. In C, you have some kidney tissue, and in D you have some liver tissue. Okay, all of them had necrotic surfaces, lots of inflammatory cells. Okay, so this was a highly inflammatory picture. Okay, this was the picture, the histopathological evaluation of the group with ozone treatment. There were no modifications. Nothing was wrong with this, guys. Even if it was with 30 micrograms per milliliter, or even better with 50 micrograms per milliliter, the 50 micrograms per milliliter looked better. So this was a pneumoperitoneum with gas, with ozone, just experimental, and it worked really nice, and the anti-inflammatory effect was quite obvious. Okay, there's another study we've made on whole horse blood. Okay, we've drew some blood from the horses and we've treated it with ozone at different concentrations. You can see them in the table, and we've managed to see that platelets dropped really heavily off at 30, 50, and especially at 80 micrograms per milliliter concentration. Okay, this gave us the idea of concentrating some dog platelets, okay, even if they are dogs and they are not horses, but to see if in dogs happens the same, and it happens the same and happens really nicely. We've concentrated from 77 platelets to 789, and after treatment with 50 micrograms per milliliter concentration of ozone, they dropped at 220. You can see in the pictures below that the microscopical aspect before and after the O3 treatment. In the picture before, you can see there are lots of platelets in the field, lots of platelets grouped there. And in the second picture, after the treatment, you can see that you can barely see here and there some platelets. So this put us a question mark. Does O3 activate PRP? We don't know. Actually, in human medicine, they say it helps with the enhance of growth factor release, but does it activate the PRP? This is a question mark, and we should research it furthermore. Okay. In conclusion, anti-inflammatory effect, perfect anti-inflammatory effect. I think this is the reason why the granulation tissue in those horses we've treated did not exuberate. Probably there was an superficial anti-inflammatory effect, and this prevented the exuberant granulation. And maybe it might quicken the release of growth factors because of activating the platelets, but more research is needed even in human medicine. Okay, they use PRP, ozonized PRP, for joint infiltrations and traumatic tendon injuries and stuff like this, sports medicine especially. But we have to prove it really, really well before taking it as gold standard. Okay, I would like to thank you for your attention, and I would like to remember a bit Velio Bocci, okay, who is actually was a god here in Europe with ozone, with all his research and stuff. And unfortunately, we've lost him last year, and that's it. This is life, but we have to take care of his research and to continue it for sure.
Yes, agreed. Thank you. Really quick, so we're going to have a break here in a second, but somebody wanted me to go back to one of these slides.
Yes, please.
Was it that slide? Or the one after? And then a question: how much ozone would you inject intraperitoneally at 30 or 50 micrograms?
1 micrograms, 30 and 50. We had two groups of study. One was with 30 micrograms and one was with 50 micrograms, and the results were almost similar. The 50 micrograms per milliliter was a bit better as an anti-inflammatory effect than the 30 micrograms per milliliter, but they worked both nicely. And okay. I think 30 micrograms per milliliter would be the first choice, because it's a bit less irritative. Okay, it's less irritant.
Okay, and what gauge needle did you use?
For these rats, it was a 21 gauge, I think.
Oh, okay, yeah. Okay. Yes. And in the dog injections, I think it was the dog ones, did you inject directly into the wounds at all, or was it around?
Around the wound. In one dog, the German Shepherd with the huge dorsal cervical wound, I've injected intralesionally. There was a bit of flash lacking. There was a bit of muscular musculature missing, and we've injected there as well, and it worked really nicely. The granulation tissue leveled everything there, and it was really great. Good. Okay, awesome. Well, excellent. There's a lot of people who really appreciate these studies because we don't get a lot of them. So I really enjoyed this.